Hey, healthcare bosses, and welcome back to the Healthcare Entrepreneur Academy podcast. I'm your host, Jason Duprat, and we are back here for another Tactical Tuesday episode. On this episode, we are going to talk a little bit about how to create a tribe and how to create a community so that your business can thrive. So one of the things that we've been working really hard to do here at the Healthcare Entrepreneur Academy is to create a community and a tribe, not just for the podcast listeners, but for essentially everyone who is students in our courses and anyone who believes and who basically subscribes to what we are trying to do here, which is create a community and a culture and an education platform that supports healthcare professionals along their entrepreneurial journey. And we've tried various things over time, and we'll talk about those throughout the podcast. But one of the things I've been doing lately is studying how to create that tribe and create that community and create that movement that I'm looking to create with the healthcare boss hashtag, with the healthcare boss, sort of nomenclature, with the Healthcare Entrepreneur Academy and all the training programs that we've put together. And I think we've made some progress towards that, but I've been doing more reading, more studying on how the best leaders are creating their tribes, their communities, and their movements, because I'm a huge believer in what it is that we're doing. We're helping healthcare professionals who are frustrated with the status quo, who are frustrated with going in and punching a time clock. We're helping them figure out how to create alternative sources of income so that they don't have to depend on that corporate healthcare job or that healthcare job that they just don't enjoy going to anymore for a variety of reasons. Maybe it's the schedule that's burning them out. Maybe it's the fact that they're not appreciated. Maybe it's the fact that they're sort of feeling like a cog in a huge corporate system. We're hopefully, I feel like we are anyways, helping healthcare professionals not only see that there's an alternative path to just, punching a time clock, but there's an alternative path to, maybe if you don't even want to be a clinician anymore, maybe if you don't want to be a practitioner, maybe you don't want to work at the bedside, there are plenty of alternatives in terms of businesses and things that you can do as an entrepreneur to earn a great income and do it in a way that makes you happy, that makes you feel fulfilled. I don't feel like anybody should have to go through life feeling burnt out, feeling depressed, feeling unmotivated, feeling like they're just punching a time clock, feeling like it's Groundhog Day, because I was there. I went through all of that. I know exactly how it is. And fortunately, after a couple of tries, I think I told you guys on the podcast that, my first attempt at entrepreneurship, as an adult was starting a hot dog cart. It didn't go so well. My next attempt was creating something called the Nurse Academy. My third attempt was creating my own practice. And that is when I finally found the path. That's when I finally got the momentum. That's when I finally had put enough of the entrepreneurial pieces together to create a business that was profitable. What spawned off of that was the Ketamine Academy, then the IV Academy, then the Healthcare Entrepreneur Academy, and now we've got Med Spa Launch Academy that we'll be launching here in December. And it sort of creates a snowball effect. And so one of the things that's, I believe, really key to that snowball effect is the sense of community that we've created. And I'm not saying that we're the best at it. I definitely don't think that we are. I think that we have a long ways to go, which is why I'm reading and studying other people who have done it, like Seth Godin. I'm reading his book right now. It's called Tribe. He talks about a lot of different things. He talks about how typically in business, in order to gain customers, it typically requires a large amount of money and massive loads of ads. So a lot of capital, a lot of ads, basically just dumping ads everywhere. And he kind of challenges business owners to, rather than focus on, marketing to the masses, he challenges business owners to start creating tribes and communities and movements. The way he says that we should be doing that is by not only challenging the status quo, that's like one of the first things that he talks about, which I think we're already doing. It's actually funny because he talks in the book about, if you're not annoying anybody, if you're not getting on anybody's nerves, then you're not actually challenging any sort of status quo at all, because you're going to be essentially disliked by some people. I'm probably disliked by a lot of corporate healthcare people who are upset that I'm essentially throwing rocks at what they've created, which most of us already know, and most of us believe that it's a system that is going down the tubes, essentially. It's a system that is on a downward spiral. It's not providing great patient care. It's not providing a great work environment. There's just so many things. And because I stand against that, I stand against the corporate healthcare system, and I'm trying to help healthcare workers find out, I'm pretty sure that I've irritated or annoyed or am disliked by the corporate healthcare people out there, which is fine with me. I could care less. I don't plan to ever go back to corporate healthcare. It would have to be something super crazy where I don't even know. I'd have to be able to make some crazy changes, or it would be a corporate healthcare system where the culture is completely flipped, which those people wouldn't be annoyed with me anyways. What he's talking about here is challenging the status quo, but then creating that community. And the way you create the community, according to Seth Godin, is to connect people with that idea that you have around challenging the status quo. And I'm telling you about what we're doing, but hopefully it's going to stimulate some thought processes in terms of how you could do something like that in your business. And so if you're running, for example, like a medical practice, well, first, what are you doing to challenge that status quo? So, for example, it doesn't have to be anything like earth-shattering either. Some of the people that have challenged the status quo have simply created, a new diet plan, or they publicly state, the corporate food production system in the United States is a complete disaster, and we're anti prepackaged and assembled, junk food. I mean, it could be something as simple as that. So say you have a weight loss practice, the status quo that you're challenging is maybe it's fast food or maybe it's packaged food. And what are you doing to do the other steps, which is connecting people and then distributing that idea? In order to create the community, to create that tribe, like we're trying to do here with our tribe of healthcare bosses, which healthcare boss is those who ascribe to that anti-status quo that we stand for, and that those who are trying to create alternative sources of income, build their businesses, and escape the rat race, hopefully. But what are you doing in your practice where you're trying to connect those people to challenge that status quo? And some ideas, potentially, just throwing some stuff out there to get some creative juices flowing for you, because there are people who have done this and they've done it extremely well. Some of the physicians, I was watching a documentary on Netflix where there's been some MDs and DOs, like physicians, who have left traditional Western medicine to create functional medicine practices and focus on the fact that food can heal, food can prevent disease, the right types of food. And they've created entire communities and cultures, movements around the idea that Western medicine has it wrong. We should be doing preventive medicine, especially through diet, and we should focus on that. So that's just one idea for like the weight loss category that I've seen work really, really well. As far as connecting your tribe or your community, what kind of tools? You got to tool them up, right? What kind of tools are you giving them to share their ideas, to spread this, to invite other people into, to organize events? You got to give them tools, right? Like in our courses, our tool is our Facebook groups. We're actually really strongly considering creating a customized app. It's super expensive. It's $30,000 a year. But I see a tremendous amount of value in building a community for you guys that's off of Facebook, because there's a lot of healthcare professionals that are on Facebook. There's privacy issues, all sorts of things, censorship, all sorts of things that makes Facebook not the best place to have a community. It's working for us right now, but we're looking into creating an app. So what can you do in your business for your community to create a place of connection?